I find this year's theme very, very relevant, primarily because it shifts the onus from the individual as being problematic when we talk about mental health and widens the picture to the environment and the global situation, which leads to mental health conditions in many cases. So this is a welcome shift. If we look at the larger macro picture, we could talk about the developed world and the underdeveloped world, the north-south divide that we talk about. So there is that huge divide, and therefore the theme unequal world could not be more literal in its meaning. But I hope that it is not just left to being a narrative, and there is some real action taken upon it. The problems we talk about in the global context are more accentuated in the Indian context. India being a country of so many cultures, so many subsets of people, so many languages spoken, this also creates barriers towards mental health awareness campaigns and so on. We have further challenges because of discrimination on basis of caste, religious minorities, sometimes political environment which act as triggers, the utter poverty that a majority of our population faces. We know how that can worsen mental health conditions, and people already living with diagnosable conditions, the lack of access to mental health care, that is something which is glaring. And the big factor where India is concerned is the rural-urban divide. We already have a paucity of mental health professionals, and within that context also, primarily most of the care is centered around the urban areas of India, and therefore the rural population is left to fend on its own. And my own experience, what I have noticed very sharply as a divide is again the division between how mental health and physical health are looked at, the seriousness about it. For instance, the lack of funding for mental health in our nation. And my own experience, at age of 14, my asthma was immediately diagnosed. My onset of bipolar disorder also happened at the same age, but it took another 26 years for it to be diagnosed. So in general, we see that positive factors lead to worsening of mental health conditions, and the persons living with these challenges are further alienated from society. Our community of Bipolar India gives me a bird's eye view of the challenges that people face in the Indian context. Prominently, the rural-urban divide, where we have people from, say, a small village in Bihar, or in a small town in Karnataka where they don't have access to mental health care, as versus those in larger metro cities who have far better access. And what is often discussed in the community is the stigmatization that happens because of the stereotypes and perceptions around mental illness in India. Big problem is lack of affordability. Because although many people have been diagnosed with severe mental health conditions, they begin treatment, but during the journey, many people struggle to keep up with the expenses, very expensive medication, costs of psychiatrists' fees, and therapy. One knows that one can access public health hospital for many of these resources at either a minimal cost or free of cost, but then again, access is not available within the reach of area of every member of our community. Therapy is generally not available in public institutions in India, or the time available for our community in general is not adequate. We also notice a lot of issues around the patriarchal model that is so much of an issue in the Indian context. Gender discrimination that some people face, and how that is a major trigger for mental health conditions. In general, there is so much of deprivation on multiple levels. Sometimes people are alienated from their own families. Broken marriages is a second refrain that I hear about much, and which is very anguishing. And broken marriages purely on the grounds of the mental health condition of the person. And something which is even a larger concern is lack of access to livelihood opportunities. We can talk endlessly about the challenges that people face, whether in the Indian context or even beyond, but I think each and every one of us needs to stand up and make a difference for this vast community of people affected with mental health conditions. So the first step that our peer support community sort of engage in is providing a safe space for people to open up, to express themselves, to develop sort of bonding with the community, and then they suddenly realize that this is an extended family, that they are not alone anymore. Second thing is real-time support is often offered through our virtual model also, where anybody in distress is lent support by fellow peers to the best of their ability, or directed to professional help if so required. We also provide mentoring to the people who have challenges with their careers or taking decisions regarding some important decisions in their life. We have launched an initiative in August 2021 named letswalktogether.org. And we are already making inroads in building tie-ups with organizations who would be willing to provide livelihoods for the persons from our community, and then moving forward from even outside our community. So we talked about the isolation and alienation of that individual from society. So our aim and primary objective is to gradually shift to a regime where the person is assimilated within society in the fullest possible sense. And we'll take all meaningful steps towards that end.